Hello, everybody. We're back now. Sorry about the shortened break that we have. We're going on to session 2 now. It's about gendered perspectives. So for many neurodivergent women, the transition in later life is not merely a biological shift, but a significant neurological recalibration as well. The intersection of menopause and neurodivergence, specifically ADHD and autism, presents a unique clinical and social challenge. Estrogen decline can remove the neurological buffer for executive functioning, causing a masking collapse where long-standing coping strategies fail and sensory sensitivities intensify. This can lead to burnout and cognitive fog, which are frequently misattributed to standard aging rather than recognized as a specific neurodivergent hormonal interaction. So I'm going to pass over to Dr. Theresa Kidd and Melanie Turner with a speech around the ADHD and autism overlap, identity, and perimenopause for neurodivergent women. So this is a pre-recorded session because we couldn't fit it in with their time. I can't hear any sound. Am I the only one who can't hear sound? We really wanted the input into this, so we did it in this way. We're just trying to sort it out. So we're sitting here in silence, all of us together. My brain is saying, "Oh, I got to fill the space," but I don't actually know what to say, so I'm going to not do that. It was a bit of an abrupt finish in the last from the last one because we got so engaged into the conversation, and the engagement with the participants was amazing as well. So much to talk about in so many different ways about this subject, and I'm glad to see I'm not the only one who's finding this very fascinating, but sad to see that we all understand that there's not enough research done at all to make this phase of life easier for all of us, not just us, but also our family members. But this is exactly the sort of starting point to try to get the conversation going. Um, whilst we're waiting for the recording.
In Perth, Western Australia.
That's
And
it.
we're here today to talk to you about ADHD and the autism overlap. And we're going to be looking at that through an identity and a perimenopause lens, both through lived experience and also through research and doing client-focused work here at the KID Clinic. So I just want to start with a bit of a values acknowledgement. The KID Clinic would like to acknowledge the Whadjuk people of the Noongar Nation as the traditional custodians of Borroloo, the unceded land in which we work, meet and learn today. And we pay respect to elders past and present, for they hold the memories, traditions, cultures and hope for their people. We also like to do an acknowledgement of neurodiversity, acknowledging the diversity of human brains and ways of thinking. We embrace the value of neurodiversity in the workplace and in the community, and we strive to create an inclusive environment for all. I'm going to let Theresa now talk a little bit about the KID Clinic and the work we do.
Thanks, Mel. So welcome everybody. The KID Clinic is a private psychology and allied health practice here in Perth, but also over in Melbourne, Victoria. And we work mainly with neurodivergent children, adolescents and adults. And we work therapeutically. We provide psychological assessments, diagnostic assessments, and we conduct a lot of training. So we train other allied health practitioners, medical practitioners, We provide support and training to parents and a lot of educators. We do a lot of work in schools as well and teaching people about autism and ADHD and PDA as well, and how to support and engage our community.
So today we're going to just give you a bit of an outline. So we're going to go through the intersection of ADHD and autism in women. We're going to talk about hormones and life transitions. And we're also going to talk about how to navigate the sort of physical and emotional changes that we go through in that perimenopause and menopause stage of our life.
So it can be helpful because obviously there is an overlap often between autism and ADHD, and we're still working out exactly what that is, but there has been a research study that found that 60% of autistic people also meet the criteria for ADHD, so we know that the overlap is common. But we thought it could be good to start first of all looking at the differences between autism and ADHD to try and tease apart what some of those differences are that occur, and then we can look at what that looks like when there's an overlap of the two. When we think about autism, we might be more detail oriented, so we might notice patterns in our environment, textures. We might notice where things stand out compared to other people that aren't autistic.
And so for an ADHDer, we might miss or skip some of the details, so not so detail oriented.
For autistic people, we quite like familiarity. So for us, if something feels familiar, then it's going to take less cognitive and emotional load.
And then for ADHD, we might be liking the novelty aspect. So, always looking for that next sort of thing that sort of engages the brain and gives the dopamine hit.
Monotropism is sometimes talked about, so that deep dive that we can do when we're autistic. So, that can feel very soothing for us, but it can also interfere with us being able to shift our attention and move on to the next thing that we have to do.
And I love this one here for an ADHD, potentially attentional ping pong.
Yeah. For autistic people, routines can be not so much about rigidity as they're often thought of, but they can be something that can help to be soothing as well, and provides us with a sense of certainty about what is going to be happening next, and that feeling of control.
And then from an ADHD perspective, potentially the impulsivity, which can be fun and not so fun.
Sensory overwhelm can commonly occur. So, if we think about as adults going into workplaces where they can be very busy and open plan, or shopping centres, which I detest going to, which can be really bright and very crowded as well, and noisy.
And for an ADHD, often the sensory sort of stimulation, so it can be stimulating, but you also might have that intense sort of boredom that comes if something's not actually capturing your attention.
And from a social perspective, there can be some misunderstanding of non-autistic social communication. So we can respond well to more direct communication, and that may also be the way that we communicate best as well.
And I think for ADHD too, like the social attunement difference, and I think, sometimes that actually can be quite difficult in different settings.
Yes,
really, can't it?
Yeah, because it can be that interrupting or just speaking, sort of out of turn, or missing, when to jump in. Yeah. So from just a bit more of a fun perspective, because we like to do that at our clinic.
If ADHD is impulse buying roller skates at 2 a.m,
then autism is researching the physics of roller skate wheels before deciding it's not the right time yet.
If ADHD is a surprise party,
then autism is a calendar invite sent 3 weeks in advance with snacks pre-approved.
And if ADHD is 25 tabs open within 5 minutes of searching,
then autism is 1 tab that has been open for 6 months and is reviewed regularly.
And if ADHD is a disco ball in a library,
then autism is a cosy fort with meticulously curated themes.
And then ADHD,
yes, we've got the two together. which I can, definitely relate to. But it can be challenging, that overlap.
Yeah,
There's,
absolutely.
a number of reasons why. Like, why is this so hard for me?
Yeah, absolutely. And I think, what we've talked about a lot of times too is like when different traits might be stronger. And I guess we like to think about them often as quite complementary. Something's a sort of a bit of a strength maybe when something else feels more challenging or a bit difficult. I think that's just trying to work out those things within your own profile, so that you can make some accommodations or adjustments around those sort of things. So I was just thinking too about how that can present those challenges in relationships often, can't it? Whether it's friendships or romantic relationships, collegial relationships, especially if you're not really understanding the other person's profile and how you sort of navigate those different things like communication. I think that's one of the challenges that can really cross domains often. Maybe one person has that sort of understanding of their own profile, or maybe they've had a self-diagnosis or diagnosis, and the other partner is not there yet. And then where those sort of challenges and communication difficulties might come in from time to time.
Another thing that can happen is that masking. So it can be looking on the surface like you're able to cope, and underneath everything feels like a bit like a mess. Or in your mind, you want everything to be neat and organised, but then you have difficulty starting things and finishing them and having them in that neat and organised way. So we can present, I guess, to other people like we are coping or able to do all of the things, but, ADHD is still there.
One of the things we've often talked about with therapy work too is that, a lot of clients often come in because they do have those really high levels of perfectionism.
When I used to work in a university setting with many autistic students, it would stop them from handing in assignments, because that perfectionism was so great. And they would be losing marks each day, like 5% or 10%, because that assignment wasn't handed in.
And as we know, what obviously a contributing factor to that too is those really high levels of anxiety.
Yeah, and I think with the masking, if you're doing that over long periods of time, then it often has that detrimental effect of resulting in autistic burnout, and then it can take a very long time to be able to regain your energy, to be able to re-enter back into social settings or workplaces or whatever it is that you might generally do on a day-to-day basis. We ran a workshop recently for autistic women on burnout, and I think there were about 30 people, wasn't there, that attended, and about 3/4 had been in chronic burnout for at least a year or more, which is, really, sad and difficult to hear. And I think because it's often not recognised, it can be mistaken for being depression, then often the wrong treatment and support is provided.
And some of the other things too, like with the challenge, can be the parental stress. A lot of our clients, we see a lot of families here, and there's a lot of challenges in that overlap, but also because multiple family members or all family members in a lot of cases have neurotypes, and trying to manage that as a parent while sort of holding your own sort of strategies in place that you need for yourself, when really you are needing to attend to young people who have got a lot of needs too, is one of the really big challenges I see come through as parents in therapy, for sure.
Yeah, when we ran that group, that was brought up a few times by the participants, was that, what do I do? I'm in autistic burnout. My child's in autistic burnout. How am I to support them when I don't have the capacity or the energy to support myself?
And then misunderstood and unmet needs. I mean, I think that would be the vast majority of clients that I've seen have felt deeply misunderstood most of their lives, and probably continue in a lot of ways to have those needs not met, whether that's by a partner or family or, in the community. So that's a challenge that people really need help and understanding with. And then, of course, the big one that we could probably speak from a lived experience perspective of is the hormonal transition and joy of perimenopause and menopause.
Yeah,
so much fun.
So we know that we have three, main hormones that really are important to consider when we are going through that perimenopause and menopause path. Testosterone reduces, progesterone reduces, and estrogen reduces, and so that of course is going to have an impact on the way that we are able to function, on the way our body functions, on the way our brain functions as we move through this transition.
And for neurodivergent women, or AFAB, we know that statistically it is likely that the hormonal transition period is going to be more challenging and difficult. And I have spoken to, my own menopause specialist in detail about this, and this is sort of anecdotally what she also sees coming through, is that the challenges are more difficult from lots of different perspectives, and the big one that comes into my brain straight away is the sensory experience of all of it. If you think of just even the sort of things that we might more traditionally know as menopause or perimenopause symptoms, like a hot flash, or the experience of sort of sweating, and that real temperature difference. It might increase things, for example, like if you're already light sensitive, it can actually make light sensitivity more difficult and challenging. And there's really obscure symptoms, isn't there?
Like the skin crawling one, or getting itchy from the inside out. Some strange symptoms that we're finding out, really aligned with this period of time. But the sensory, for me, those sensory sensitivities were really pronounced during perimenopause. Like, my ability to be able to sit with different noises, people scraping their plates, which was always difficult. My whole sensory system has exploded during this period of time.
And I was listening to a great podcast ages and ages ago now, and they were talking about really reflecting back on your menstruation journey and then pregnancy journey if you went down that pathway, and then what that looks like with your perimenopause. And it tracked perfectly for me, that my experience has been difficult all through the hormonal journey. So I thought that was sort of quite interesting too.
Yeah, so if you've been, like I was very sick throughout my pregnancy, so they were hard. You had those really strong symptoms during those, P stages. So puberty, pregnancy, perimenopause, and those symptoms are likely to be stronger. And I think, the other part we haven't spoken about as well is just like that brain fog, like how, our cognitive abilities. We're so used to being able to do all the things, particularly if you've got that ADHD profile where you can be quite organised in ways, but then you've got the ADHD that can drive you and give you the energy. But then during perimenopause, you just find that, I just don't have the capacity to do all of the things anymore that, I was able to. So, that can be really hard because you start to think, what's wrong with me? What's going on? But then you realise, this is why. I haven't got all of those hormones supporting me that I've had all of these years.
And I was just thinking, adding to that, if your own expectation for yourself has been that you've always been able to manage many different things to a pretty high standard, quite perfectionistic, quite rejection sensitive, you can imagine that at that time then, I often have people just describing it like just the walls are crumbling down, like it's just like everything that ever sort of scaffolded you just sort of dissipates. And a lot of people are just left not really understanding at all about what's happening. I mean, we were talking about it before, everyone's had a very different experience of how they were introduced to their own menstrual cycle, or, how that was for them as teens or whenever they started menstruation. But we know that in perimenopause, estrogen is such a protective factor for so many different things. I found that really surprising to know how many things estrogen was actually responsible for. So when estrogen starts to drop off, often depending on where testosterone and progesterone sit in that, really sort of can decide in this sort of cycle, how you're going to be feeling. So we know, for example, even starting at the menstruation period, both estrogen and progesterone are low at that time. So often people will experience quite a relief with the onset of the period. And of course, that is often because of the hormones being at that same sort of low level. And then moving on from once the period has finished and going into the follicular stage, estrogen's still starting to go up and progesterone is still low. So progesterone is that sort of hormone that comes on and rises when the uterus is actually putting on that lining for the release of the egg. And progesterone is one of those hormones where it can feel, to be honest, quite rubbish for a lot of people, because it can make people feel really cranky and really heavy, if you've ever had that sort of sensation in your body. As we move into ovulation, this is usually when people are feeling pretty good, because we were talking about it as a joke, from an evolutionary perspective, there has to be a period of, that time in your cycle where, in fact, evolutionary, we're thinking about, the mating period. So that's when people are having a bit more energy, testosterone in women comes up a little bit. So you've got the energy and you've got the ability to want to do that, sort of mating activity.
And I guess in terms of like ADHD, is that more social engagement is higher during that period of time, and you have more processing capacity, like, things are easier to get done during that period of time.
And then moving into that luteal phase, which is that really pre-period. You might reflect for yourself about what that experience has been like for you, but when estrogen goes down and progesterone rises, ready for that egg release, that can be a really, really tricky time. I was just thinking too about the people that experience PMDD, TK, and how hard that is, because that's generally about a 2-week period of a month, isn't it?
Yeah, we're seeing, a lot of overlap between PMDD and autism as well. So, it seems to be occurring, more often for our autistic clients.
So it just gives you a little bit of insight, doesn't it? If you have a really tricky cycle and you really can relate to having a really difficult month as you move through these different stages in the cycle, to think about for someone that has PMDD and to experience this for that really intense 2 weeks of a month, it's really massive impact on mood.
The dopamine is lower, so your ADHD symptoms can be higher during this time as well. You can have more emotional, intensities, might be more reactive to, what's going on in your environment, and have more sensitivity to demands placed upon you as well. So there's just so much that goes on for women and AFAB people during this period of time.
So with perimenopause and menopause, and this might be information already known, but usually happens between the ages of about 45 and 55, but obviously it can happen outside of those ages too. I remember my doctor saying to me, really, we're looking at women or AFAB up to probably 35 and over. So if I'm seeing people in therapy, sort of once people are hitting that probably late 30s, this is a conversation that's starting to come into a little bit about just holding that in mind. This could be a thing that is starting to happen, because it doesn't always turn out for people that all of a sudden you've just got no estrogen. It can be such a roller coaster through perimenopause. It's just all over the place. So you might have that cycle where some months estrogen's much higher and other months it dips really low, and so it's a roller coaster. And like you say, with ADHD, etc., it's just further highlighting all of the struggles that you might be having.
Yeah, anxiety, as we know, commonly occurs for autistic people. Like in at least 85% of people are going to meet the criteria of at least one anxiety diagnosis. With perimenopause, that might be something that you notice. It was my first sort of symptom, I suppose, where I had a real, panic feeling as I was driving, and I just thought, what's going on here? It came out of nowhere, and fortunately I was able to sort of link it to, it might be hormonal, and then I went to see my doctor. And I think we can be so used to having high anxiety, but I think if we start to notice like a difference in those anxiety levels, then that could be a good time as well, or in depression, or just in just cognitive functioning, it's a good time to go and see somebody.
I think that's such a good point, because we're probably already operating at higher levels of anxiety anyway. So it really has to be that difference, doesn't it? Because the baseline's already up here anyway. A lot of what I'm sort of seeing in my own experience has been having that late diagnosis of ADHD has, come at that time where estrogen being sort of, I sort of like to think about it like the scaffolder. It's the thing that helped you keep all the things in place that kept the things in place. And in the absence of it, all of that sort of dissipates, and then
like the conductor, like when we think about ADHD and they, executive functioning, it's a bit like that with estrogen. Come back, estrogen.
It really, I guess it's a two-way street. ADHD traits and symptoms are difficult, but then the menopause symptoms or the perimenopause symptoms are really difficult too. So it's like...
Yeah, and sometimes the perimenopause stage is where people discover that they are ADHD or are autistic as well. So because those symptoms all exacerbate during this time, it can be a time of self-discovery and, sort of understanding yourself more and realising that, oh, okay, I've actually had these characteristics of ADHD I've had them all along, but they're more pronounced now because I'm not being able to cope in the way that I was because I don't have that estrogen, that conductor, sort of helping me with all of the parts of my life.
So there are some things that can help, and I'm certainly not promoting one thing over another, but MRT or what was known as HRT, the hormonal replacement therapy, which is now menopause replacement therapy. But also it might be that with the introduction of some hormonal replacement, that the missing element can sometimes be the ADHD medication, as I've spoken to psychiatrists and doctors about this. But it's going to be different for everybody, and of course all of the strategies and the counselling support and everything. I think it's just a full picture of all the things that you can get to help yourself.
Having people in your life that understand perimenopause and menopause, and particularly for you, what it is that you might be struggling with, where you might need supports, that might be your partner, your children. I'm talking to my, young adult children now about perimenopause and menopause, so hopefully give them, a bit of language around it. But it might be more professional support as well. So it might be seeing a psychologist, having a really good menopause GP, and having somebody to help you to set boundaries. I think we can, as women, often be saying yes to so many things, whereas this is really a time for us to start to, say no, because we need to be aware of our energy and account for that, because we're not going to have the same energy levels that we did 10, 20, 30 years ago. And I know there's been quite a bit of talk in terms of our government here in Australia talking finally about menopause and supports that they might need within a workplace, but also that they might need to have reduced days of work.
And we also have lots of specific challenges at this stage of life too, like in terms of the idea of the sandwich generation. You might have elderly parents. As people have lived longer, we seem to be the generation that's come up now where we potentially might have elderly parents that we're supporting, where we might still have with the challenges of, being able to move out of the home for a variety of reasons. We might still be supporting young people at home with different challenges. So
because if we're neurodivergent, then our children are most likely neurodivergent, so it may mean that they're still needing levels of support. It could also mean that our parents might be neurodivergent too, even though that may have never been diagnosed. But definitely the pressure of that sandwich generation, finding time for our young people, our parents, and then where do we fit in the middle of the sandwich.
And one of the big things that start really focusing on in the sort of like therapy support and journey is often this idea around self-compassion. We find that people are very compassionate to everybody else and able to provide lots of support or have pushed beyond to provide lots of support. But when it comes to them and looking after themselves in a way that feels sort of right for them, and giving themselves a break, as in giving themselves like a mental break to sort of say, hey, it's okay, to just do you for a while. And, for a lot of us might have even got brought up in that generation where you sort of didn't sit idly around.
No.
And it's not sitting idly around. It's actually about really taking care of yourself and looking after your brain and your body, doing movement if that feels right for you, and all of the different things that can provide a real challenge. But it's sort of like you need a whole menopause treating team, isn't it? Like you need support from your family, your friends, you need support in the workplace, you need support probably from a great doctor to really scaffold yourself through what's a really hard time. It can be a really hard time.
And then, I think being able to advocate, like once you understand what your particular needs are and what's working for you, whether you need to do less of this, say no to that, take more time for, something that's going to be more nourishing or nurturing for you, and then being able to advocate for yourself as well, and letting people know what it is that you are needing. And if you're not able to do that, that's also totally fine, but having somebody that can do that for you, or finding ways that you can communicate your needs that, it might not be through speaking, it might be through texting or emails, whatever your preferred communication method is. But it's really important to know what it is that's going to be helpful for you. And as Mel said, it might be, understanding that through the help of other people, but then being able to make sure that you're getting some of that, because that's what's going to help you to get through this big transition.
Absolutely.
Yeah, fun and games.
Yeah. Thanks everybody for listening, and if you would like any more information, feel free to contact us at the Kid Clinic. You can find our website at www.kidclinic.com.au. Thanks.
Thanks everyone.
Thank you very much. I hope you all found that informative. I certainly did. Thank you. And Jessica, welcome. I'm so sorry we went 8 minutes over. We just got a bit too enthusiastic in the panel we had before. All my fault. I'm sorry.
No problem.
But here you are. So welcome to this event, and thank you so much for speaking. You're speaking about ADHD during menopause. So you saw a bit of what we looked at already, and over to you. If you want to introduce yourself first,
Sure.
Thank you so much.
Sure. And I'll share my screen as well. So I'm Jessica Agnew-Blais. I'm a senior lecturer in psychology at Queen Mary University in London. Hopefully you can see that.
Yes,
Great. Thank you so much. So yes, I'm in a department of psychology, but I'm actually trained as an epidemiologist. And a lot of what I think perhaps I'll be talking about today will feel maybe less practical than what I saw at the last talk, but hopefully it will still be interesting to know kind of the state of the evidence on ADHD and menopause. So just to give a bit of an idea of what I'll touch on today, first let's just say a little bit about what is ADHD, talk a bit about women and ADHD more broadly, and then get to what we know about ADHD and menopause, including why do we know so little about this, why we think women with ADHD might experience more problems during menopause, what the women are telling us, what the data, such as it is now, shows, and then some of the remaining questions, of which there are many. And I'll try to go quickly enough so that we have time for questions. So as I'm sure many people know, ADHD is a condition characterized by impairing levels of hyperactivity and impulsivity. So this is things like being restless, kind of interrupting people, not thinking things through, as well as inattention. So this can be being distracted, being forgetful, avoiding tasks that are really boring, like doing your taxes or paperwork. And it's estimated to affect somewhere between 3 and 7% of children and adolescents. And I want to contextualize ADHD in the broader kind of understanding of neurodiversity, in the sense of ADHD as an extreme of a continuum in the population. So everyone kind of has these traits, and they're sort of like this normal distribution we see here. And, we draw some kind of somewhat arbitrary line as evidenced by this orange line here, above which we say people with this many symptoms we consider to have ADHD. And even though, the acronym ADHD has the word disorder in it, I like to, I tend to refer to ADHD as a condition, and thinking about it from this perspective of neurodiversity. And this is a quote from a really nice piece by Edmund Shnugabark and Anita Thapar, where they say that ADHD involves variations in brain structure and function, which lead to ways of thinking and behaving that are different from most people in society. Any impairment experienced by neurodiverse people occurs not as an intrinsic part of the disorder, but because there is a mismatch between their ways of thinking and behaving in their environments. So there's nothing intrinsically negative about ADHD itself, but there's this mismatch that can occur where people face potentially more challenges when they have ADHD. So what about ADHD in adulthood? It's kind of relatively recent, although I guess maybe not so recent anymore, that we are thinking of ADHD as something that extends beyond childhood. In kind of like the 1950s, 60s, 70s, there were these studies that started following children with ADHD forward, and they realized that not everybody's ADHD went away. They used to think that it was kind of only something you had in childhood. And this figure here is from one of those studies where they followed forward these children into adulthood, and they realized, lo and behold, some of these people continue to have high levels of ADHD symptoms into their mid-20s and 30s. There are some changes that tend to happen as people get older with ADHD, so it's more likely that their symptoms will be more kind of like internal restlessness and inattention as opposed to sort of more overt hyperactivity. The prevalence of adult ADHD is about 3%. So what about gender and ADHD and gender and ADHD in childhood? So we know that ADHD diagnosis in childhood has this really strong male preponderance. So between 16 to 1 to kind of 3 to 1, depending on the population, is the male to female gender ratio. And there are these two kind of, broadly but not mutually exclusive explanations for this. So it is possible that there's biologically maybe there are fewer girls that have ADHD, and this is often called the female protective effect. And there's kind of some mixed evidence for this. Some work saying that maybe women with ADHD have a higher genetic burden of ADHD traits compared to boys, but this is kind of equivocal at this point. Another explanation for this is that there's underdiagnosis of ADHD amongst girls. And I just want to, oh, here we go. And one kind of piece of evidence for that is that by adulthood, the gender ratio is closer to 1 to 1. So we see this evening out of males and females and who has ADHD. And this is kind of really suggesting that perhaps we're sort of missing girls earlier in life. And we also know from epidemiologic studies that women are more likely to receive their ADHD diagnosis after childhood than males. And there's a lot of different reasons for this, potentially, and some of the work by Joanna Martin that I'm citing here on the bottom. She has a very nice paper that goes through some of these different reasons why girls might be overlooked. Sometimes they can have less overt symptoms, so they might be more sort of daydreamy than kind of hyperactive and running around, so kind of less disruptive. They might have less traditional ADHD symptoms, so being more talkative or having some more emotional dysregulation that people don't consider as sort of classic symptoms. There's also some evidence for what we call diagnostic overshadowing. So if people see a girl who's struggling, they might think, oh, they're more likely to have depression, they're more likely to have anxiety, and then their challenges get attributed to that as opposed to investigating ADHD further. There's some evidence that there might be some sort of gender bias amongst parents and teachers and clinicians. I think this is getting a lot better, but maybe a few decades ago, people really thought of ADHD as kind of more of a boy disorder, so it might not have come to mind for girls as much. And there's also increasing work looking at masking and compensation. So sometimes women talk about, the amount of energy they expend trying to kind of tamp down their ADHD symptoms. So to kind of mask them or compensate for them. So they might be less obvious in girls. And this is just some evidence here on the right. This is a study from Denmark where they show, so the lighter line here are boys and their age of diagnosis, and the darker line here are girls. And you can see even amongst people diagnosed prior to age 18, you really don't see girls starting to get diagnosed until kind of 12, 13, 14, 15, 16, whereas for boys, it's shifted much earlier. It's more like 6, 7, 8. So you can see even within childhood that girls get a later diagnosis. And this can result in or be associated with women, when they get diagnosed later on, already having a lot of comorbidities. So there was a study from Sweden that found that women presenting with ADHD in adulthood had more comorbid anxiety, mood disorders, and substance use disorders compared to men. And anecdotally, this kind of late diagnosis is something that women talk about a lot. So, in these various factors like masking and overshadowing of other diagnoses. So for example, a lot of women I talk to say, I had a diagnosis of anxiety, of depression, of borderline personality disorder, and then they kind of finally get their ADHD diagnosis in adulthood. And many people talk about feeling quite derailed in their lives, especially around schooling due to this missed earlier diagnosis. And this is a quote from one woman that I was talking to who said, "I think of how much I could have done if it had been caught earlier." And this is just an interesting study from Wales that I thought was super interesting in light of this idea of diagnostic overshadowing. So they found in this study that women were more likely to be prescribed antidepressants prior to their ADHD diagnosis than men or boys. And they also found, as you can see here, that after the diagnosis, and this is all based on records of diagnosis from Wales, after the diagnosis, the women were more likely to discontinue their antidepressant than the males. So it does kind of add some evidence to the idea that maybe once the ADHD is kind of sorted for women with ADHD, they're able to discontinue these other medications and may no longer have those other disorders. So maybe they weren't comorbid necessarily, but maybe they were kind of overshadowing their ADHD diagnosis. So now I will talk a bit about the main topic here today, which is ADHD and menopause. So as was mentioned previously, the menopausal transition is this time where you have these declining levels of progesterone and estrogen, and this can present, it seems to be a special challenge for women with ADHD. And these are some quotes from some PPI work I've done with women with ADHD. And they said, my friends and I who are going through perimenopause, and my friends with ADHD, we just struggle more. And another woman said, the scatter of my memory is just on a different level. I thought I had early onset Alzheimer's. So just to go over briefly, so the transition to menopause, as was mentioned earlier, this is not, we think of menopause as this, defined as this 1 year without having a menstrual cycle. But, really, this is many years prior in which there's fluctuations in hormone levels and then this ultimate decline. And there's a lot of individual variation in this. So what this graph is showing is that, some people have this kind of slow and steady decline of these hormones over time. Some people have a sharper decline right before menopause. So there's a lot of differences between people and how this plays out. But later in the menopausal transition, cycles become unpredictable and eventually decrease in number, and women are exposed to progressively longer periods of what we call estrogen withdrawal. So why is it that we know so little about ADHD and menopause, aside from kind of general, patriarchy and whatnot? So, there is this historical focus on ADHD as a kind of male disorder. So I think a lot of aspects of ADHD that are relevant to females, so for example, times of hormonal change, have been relatively understudied. A lot of population-based studies where, for example, these UK cohorts, we get a lot of our research about ADHD because of ADHD, being thought of as this childhood disorder. Sometimes they would just stop asking questions after childhood. So some of these UK cohorts, they would ask about ADHD symptoms when they're 7, 8, 9, 10, and then they just stop. So you don't have a lot of information about ADHD symptoms in adulthood. And for both ADHD and the menopausal transition, especially perimenopause, there's not clear biomarkers. There's not a test you can do. There's no blood test that says whether you have an ADHD diagnosis or not. I mean, there's maybe a blood test that could say you're postmenopausal, but perimenopausally, there's a lot of fluctuation. So there's no one test you can do to define either of these things. And that makes research on it quite tricky. A lot of studies don't ask questions about menopause, or if they ask, they usually maybe would just ask about age of menopause. But many of the big studies, like UK Biobank, for example, don't ask a lot about symptoms of menopause. So we don't know a lot about that. And it's not something that's captured in these registry studies. So, for example, that study I was talking about in Wales, the one from Denmark, the one from Sweden, they're looking at ADHD diagnosis that are captured in these big national databases. But menopause tends to not be a diagnosis code that people give. So you don't have that source of information to look at this issue. So these are some of the reasons that research on this is quite tricky. But why is it we think that women with ADHD might have more problems during menopause? Well, there's kind of growing evidence that in general, women with ADHD might have a higher risk for what we call hormonal sensitivity. So basically having more adverse outcomes during times of hormonal change. This is something that's been found postnatally. So there's a study from Sweden that found that women with ADHD had about 5 times the rate of postpartum depression and about 5.4 times the rate of postpartum anxiety compared to women without ADHD. There's also some interesting work also from Sweden looking at effects of hormonal contraception, and they found that women with ADHD who initiated oral combined hormonal contraceptives had 6 times the risk of subsequent depression compared to women without ADHD. Although interestingly, they didn't find a differential risk for depression for non-oral hormonal contraceptives. So this would be things like the coil, for example. And there is a biological rationale for this. So you've already heard about estrogen, for example. So I'll just go through this quickly, but there's a strong biological rationale linking estrogen and ADHD. So dopamine is a key neurotransmitter associated with ADHD. And for example, we know this because stimulant medication acts by reducing dopamine reuptake, and estrogen can affect dopamine availability. So overall, it appears that estrogen has kind of like a facilitating effect and is kind of pro dopamine availability. And drops in estrogen, so for example, premenstrually or during the menopausal transition, might result in lower dopamine availability. Although a lot of this research comes from rats as opposed to people, but I think the idea is that the same kind of concept would apply. Additionally, there's some evidence that women with ADHD may be more likely to have premenstrual dysphoric disorder. So this is kind of like a quite severe form of PMS that people have prior to menstruation that has a lot of negative consequences. So this is a study from the Netherlands that found that women with ADHD had about 45.5% risk of PMDD, which is quite high. They found a risk amongst women without ADHD that was also relatively high, about 28%. But you can see that amongst the women with ADHD here in the dark, in the circle to the right, there was a much higher rate. And then we've done some work here in the UK. So we did an online study of 715 women, and we assessed PMDD and ADHD. And we found a rate of PMDD among women without ADHD of about 10%. The women who had a clinical diagnosis of ADHD, so they had a diagnosis from a doctor, for example, their rate of PMDD was about 32%. And when we looked at women who had ADHD based on like a questionnaire about ADHD symptoms and impairment, because we know there are very long wait lists for diagnosis, for example, when we made this cutoff based on that, the rate of PMDD was about 41%. So you can see it's a much higher rate amongst women who also have high levels of symptoms and impairment based on ADHD symptoms. There's interestingly also some, I won't go into this much, but there's some genetic evidence that suggests a link between ADHD and age of menopause. And I think, so there's all these kind of like data reasons and theoretical biological reasons why we think there's a link between ADHD and menopause, but there's also just the fact that many women are telling us this, and we should just take their word for it. So for example, this is a survey from Attitude Magazine. So not a scientific journal, but there's not a lot of research on this topic, so we'll take what we can get. So this was a survey of about 1,500 women, and from these survey results, they found that 94% of respondents said menopause had made their ADHD symptoms worse. Over 50% said the menopausal transition was the time period in their lives which ADHD had the greatest effect on their lives. And they noted the most impactful symptoms were brain fog, memory issues, and a feeling of overwhelm. We've also done some work in my research group with qualitative interviews with women with ADHD, talking about this transition, this menopausal transition. And so I just wanted to share some of the quotes from this. So they'll say, for example, they felt their ADHD became more prominent during menopause. So it's like ADHD has kind of burst through as I've hit menopause. And menopause has massively affected my ability to manage my ADHD symptoms. They said, being neurodiverse, you're probably having ADHD, it makes menopause a lot worse, a lot more intense. There'll be other factors, I think, for people that make it more intense, but the brain stuff, the organization stuff definitely seems to make it worse, I think. And this is a theme that comes up a lot, around this kind of issue of brain fog during menopause. And women saying, if I don't write it down, it's gone from my head. And it never used to be like that. And as I mentioned before, this woman said the scatter memories on a different level. I thought I had early onset Alzheimer's. And it's interesting also, in the context of the care they've received. So some women said that they were kind of brushed off. So for example, this woman said, I've been to the doctor a few times about it saying, look, am I menopausal? Because it's difficult. And they were just like, are you getting night sweats? No, then you're not. But then some women actually had pretty good experiences. So another woman said, my GP, she is personalized, she really listens. It was easy to get that referral because I think she just seemed to have quite a good knowledge of the interaction with menopause and ADHD and autism and other things I talked to her about. So it's good to see that while some people, it's not great, some people are kind of having experiences where they feel brushed off. Some people are really being listened to, for example, in clinical care. So that's great to hear. So this is a bit data heavy, so apologies in advance. But what is the data telling us about this? So we have these kind of qualitative studies and these large surveys from Attitude Magazine. So there's basically 3 studies that have looked at this of all the studies. But they're coming more frequently because last year when I gave this talk, there was only one. So this is an example. So this is the same study from the Netherlands that looked at the rates of PMDD amongst women with ADHD. And I've put these red boxes here around, so the group of women with ADHD compared to women who were just contacted generally on a telephone survey. And you can see that women with ADHD scored much more highly on the green climacteric scale. So this is kind of a scale that asks questions about menopause. So they have higher rates of anxiety, depression, somatic symptoms, vasomotor symptoms, and sexual dysfunction on the scale of menopausal symptoms. So this is one piece of evidence that we have that looks to support the idea that women with ADHD are having a more difficult menopausal transition. Interestingly, there was recently an online survey study in the UK that found a bit different results. So this study recruited people online, kind of through social media. And one thing that's interesting about it is this study did exclude women who were on menopausal hormone therapy. So they're not in this, or women who are on contraceptive pills. They were all excluded. And then they asked people about whether they have an ADHD diagnosis. And then they also gave them this scale, the adult ADHD self-report scale. And then they asked them about menopausal questions from the Women's Health Questionnaire and a questionnaire called the Menopause Specific Quality of Life Questionnaire. And what they found was there was maybe some suggestion that women with ADHD might be having a bit poorer sleep, a bit worse memory and concentration, which we might expect. But they didn't see a lot of differences between these two groups of women who had an ADHD diagnosis and who didn't on these kind of menopause specific questions about hot flashes, things like that. So they didn't see in this particular study in the UK what they had seen previously in the study from the Netherlands. One interesting thing was when they looked, not comparing the two groups of with ADHD and without, when they used the scale where they added up the number of ADHD symptoms people had, they did see an association with higher numbers of ADHD symptoms being associated with more symptoms of menopause. So there could be a lot of different reasons for this. Maybe the clinically diagnosed ADHD group wasn't very representative of the group who really, has ADHD in the population. Maybe they have a bit more statistical power to detect effects when they're using, all of these traits. But this comes back around to give maybe a little bit more evidence there is an association here. And then this is some work from Iceland, also just within the last year, that looks at women with ADHD in this cohort study compared to those without. And again, we see that women with ADHD are reporting more symptoms of menopause across a range of different types of symptoms, so psychological symptoms, somatic symptoms, urogenital symptoms. So again, we're seeing some additional quantitative evidence that women with ADHD have a more difficult time during menopause. I just wanted to present a little bit of work that we're doing now that I won't go into too much detail, but there's this cohort study in the UK called BCS 70, which is a British cohort study born in 1970. And this study measured ADHD symptoms in childhood. And then in the later waves in adulthood, they asked about menopausal symptoms. So what we've done here is to look at whether childhood ADHD symptoms are associated with symptoms of menopause, kind of 40 years later. I'm looking at childhood symptoms here because they don't ask about symptoms in adulthood. So that's the only thing that I have. So it is not ideal, but we can work with what we have here. And we do find, this is kind of preliminary data, but we find that people who kind of scored particularly high at age 10 on this scale for ADHD symptoms did seem to later report higher levels of hot flashes and night sweats at age 51, and as well a bit earlier, age 46. And this is accounting for statistically their childhood social class, ethnicity, and hormone replacement therapy use. So again, we're seeing, this is kind of a little bit more evidence to say that there's some association between ADHD and having more problems during menopause. But there are so many remaining questions. So, the question of whether women with ADHD kind of in the general population, do they experience more symptoms during the menopausal transition? The current results are a little bit mixed. I mean, I would say that is probably a bit more on the side of evidence that they do, but not all studies find that for all different groups. We don't know a lot about whether they might experience different symptoms, more severe symptoms of brain fog, for example. We don't know if women with ADHD respond differently to menopausal hormone therapy. Do they receive the same benefit from similar doses? Do they need different doses? Does ADHD medication work differently? Is it less effective? Or are there more side effects during the menopausal transition? These are all open questions. And I think kind of a fundamental question that we have to grapple with is how do we distinguish ADHD symptoms from other kind of menopause symptoms like brain fog and forgetfulness? And an interesting complication to this, so this is results from a study, and this is amongst women who did not have a history of ADHD, and they found significant improvement in ADHD symptom score and some kind of cognitive tests amongst these healthy perimenopausal women and early postmenopausal women who were experiencing executive functioning difficulties. So here we're using, these women were contraindicated for hormone replacement therapy. So they treated their brain fog with stimulants, which were an ADHD medication, and they had some improvement. So it's just kind of further complicating how we disentangle these things. Um, and I just wanted to flag, so we have a new study that just got approved yesterday that's going to investigate the current clinical care pathways and barriers and facilitators to care amongst women who are presenting with ADHD symptoms potentially for the first time during the menopausal transition. So if anybody here is a clinician who works with individuals who have ADHD symptoms during the menopausal transition, and you might be able to participate in an online focus group this kind of June and July, please send me an email. It's there on the bottom of this poster. So just to conclude, there's this converging evidence that women with ADHD may be more sensitive to times of hormonal change, and many women with ADHD report exacerbation of ADHD symptoms during the menopausal transition, but we have many more questions than answers at this point. And I think I just wanted to contextualize menopause and ADHD in the context of this growing understanding that ADHD is not just a static thing. There are fluctuations in people's symptom levels and impairment depending on the current stressors in their lives. And this is a figure from a study that followed people from childhood into their early 20s. And the more they ask about their ADHD symptoms, basically, this year and then the next and the next and the next, you see a lot of fluctuation depending on what is going on in their lives. So it's not that your symptoms are up here all the time. There's a lot of change. And this is something that wasn't always considered very much in ADHD. And it may be that the menopausal transition is one of these stressors that can exacerbate ADHD symptoms. So thank you very much for listening to my collaborators. And if anyone wants to get in touch, this is my research lab and my email and my, I guess, handle on Blue Sky. And I, love to answer any questions that people.
Oh, did she just disappear? I'm not quite sure. I was about to say, any questions, anyone? But it seems that we might have lost her. Let's see if she might log in again. Maybe it was when taking the paper down that she cut herself off by mistake. There's so many discussions within the chat. That's really great to see. And it seems that there's quite a lot that a lot of us can relate to. It would be quite nice maybe, but we couldn't find anyone who'd done research on that to explore ADHD, autism, neurodivergence, and men's midlife crisis, because I think there's definitely also changes in hormones there for men, and it's not really recognized as a thing to talk about. But definitely there's also some impacts there. Jessica, hi. Sorry.
Sorry, my computer died, right, I guess at the right time, but not at an ideal time. So I'm back on my phone. So here I am.
Thank you. Thank you so much for that. It was incredibly informative. I don't know if you could follow the chat. People very actively relating to everything.
Oh, good.
It had some great facts as well. We like facts to lean on. And I was just saying that there isn't so much interest in doing research around neurodivergent men and their midlife crisis, because the midlife crisis is not really at all visible. So I wanted to, I was part of a big membership organization some years ago, and I wanted to have M&M mornings, menopause and midlife crisis. And when I said that to the board, they looked at me as if I was crazy because men don't want to talk about it, but actually it needs to be talked about. Is that something that's come past you at all?
That's a really good point and an interesting question. And I do feel sometimes a bit gender essentialist in some of these things I'm talking about, in the sense that even if we think about later diagnosis for women, many of the things I'm talking about could apply to boys with ADHD who just aren't super hyperactive and are just a bit quieter or more inattentive, and they might get diagnosed later as well. But I think it's a very good point that, maybe I think people love, on some level, the vasomotor symptoms really help people feel like there's this real thing going on. So you have hot flashes and you have this thing, and it's maybe a little bit less obvious for men, but definitely important as well.
Yeah, and I think for men inside, it is kind of obvious because some of them suddenly like change their life in quite extreme ways. And suddenly, like 5 years later, they go, why am I here on a motorbike with a younger woman behind me? Right. And it's kind of a bit like a shock to some. I've worked with men all my life and I hear it from them how they go, what the hell happened? Right. So but it's more we're laughing at it a bit. Anyway, so this was about women, and we have a lot of women in the participation. So I don't have any open questions in the Q&A, but so many of the participants was just saying, "Yeah, I got diagnosed around menopause or perimenopause," which was interesting. I mean, I got diagnosed at 50. I finished periods at 57, so you're in perimenopause like 10 years before. But this was triggered by a friend who said, "Do you think you're autistic?" And I was like, "No, why would you say that?" And then I realized I was when I started looking into it, which is, it's a lot to deal with whilst you're dealing with fluctuating hormones, right? And in that way, I think it's good that younger women are now getting diagnosed before they have that double whammy in a way, because I was just trying to get my head around everything and re-looking at my entire life in a completely different or through a completely different lens. So I think that's it is a double it and yeah, it was a lot.
Yeah, I agree. And I think, I think more and more as people understand, that women can have ADHD as well, that yes, we'll know earlier on, and that, you'll have at least some coping strategies kind of in place, even if the same ones might not work or they might not work as well. At least
Yeah.
you kind of know more about what works for you kind of heading into this sort of transitional period.
And because it is quite a significant transition, if you have a double transition from thinking you're neurotypical to realizing you're not, and then the whole hormonal thing, it's interesting, not interesting. You know what I mean? It's both. So, but the research in it is fairly consistent, right? And there's a fair amount of it as well. And that's
Yeah, I think I mean, it's becoming more and more. I mean, something that's interesting with some of these studies that look across a broader range of ages, like from the study from Iceland, for example, you already see some differences between kind of the ADHD group and the non-ADHD group on some of these, questionnaires they're giving or surveys they're giving
yes.
about menopause and things like that. So it might be that women are sort of already experiencing more fluctuations if they have ADHD, or it's an interesting thing. But I'd say, there's really only three quantitative studies that look at this at all. And even kind of the question of, many women say they get their diagnosis for the first time during the menopausal transition or during perimenopause. But it's actually a pretty tricky question to look at because, we don't have that recorded in the data. So sometimes people say, is this true? And I'm kind of like, well, that's what people are saying, but I don't have the numbers to really back that up at this point.
And because there's so many complexities, really, it's very, very layered, as human beings are in all our beauty, right? But everything is quite layered. So, if anyone has any questions to Jessica, please put it in, and then we will wrap up within the next couple of minutes. I think everyone, we've been here all day, not all day, since 2 o'clock. So everyone is maybe going, yeah, no, it's time to leave. So thank you so much for being here, Jessica. It was really,
Thank
really,
you.
we
Thank you for
had
having me.
We have recorded it, so we're going to be resharing it going forward so that you might get more people, contacting you as we share it much more widely. So
Great.
thank you so much. Thank you so much, everybody, for
Thank
being
you. Thanks for having me. Thank you.
here. Take care. We will round off today. Thank you, all of you. We have lost about half of you, I think. So it is time to go and have your evening. It's time for me to feed my dogs, who are now going around in circles around me. And I look forward to seeing you all again tomorrow, hopefully. Have a lovely evening. Take care, all. Bye bye.